question, the member for Toronto Centre.
Thank you, Speaker. My question is to the Premier. Michelle Hurtubus at the Centretown Community Health Centre recently told the CBC that people have to wait more than 2 years for an appointment at her clinic. It's the only one in her city that specializes in trans health. Speaker, does this government believe that waiting 2 years for a primary care doctor is acceptable? And what is this government going to do to help trans Ontarians access gender-affirming health care?
Good question. Minister of Health.
Thank you, Speaker. I appreciate the member opposite's question because it gives me an opportunity to talk about some of the great work that we're doing with our Ontario health teams, including, of course, the family health, CHC's family health care practitioners that provide guidance and resources that could be used for all primary care providers when caring for transgender individuals, and that's the Sherbourne Health Centre, or CHC. We have many primary care teams across Ontario who run primary care programs as part of their LGBTQ+ services or specific clinics for trans populations providing interdisciplinary primary care services. These are teams that work together, including mental health services for their clients. In addition, we have a couple of examples of family health teams, the Chinguzi in Family Health Team in Aurelia, an interdisciplinary program created to provide trans health care, mental health care, education and system navigation for trans or questioning people and their loved ones living in the North Simcoe-Muskoka region. We have the Queen Square Family Health Team in Brampton. Again, trans health programs supporting trans individuals with access to supportive, team-based...
Thank you. Thank you. The supplementary.
Thank you, Speaker. Unfortunately, none of those services necessarily help the resident who's actually in Centretown Community Health Centre. But we all recognize that gender-affirming healthcare is life-saving healthcare, and during the last Parliament, my predecessor, Suze Morrison, tabled the Gender-Affirming Healthcare Advisory Committee Act, a bill that I'm looking to retable with wide support from everyone in this House. Speaker, will this government commit to helping all Ontarians, including trans Ontarians, by ensuring that they support the Gender-Affirming Healthcare Act when I retable the identical bill?
Minister of Health.
Thank you, Speaker. So as the member opposite would know, when individuals have the right to table either resolutions or PMBs in this legislature, we will obviously carefully review that and assess the value of moving it forward. Thank you.
That concludes our question period for this morning.